Alternative Physical Therapy, and we are here today to talk about shoes and feet. If your physical therapist or your provider is not looking at you head to toe, looking at your feet, looking how your feet move, especially when you're weighted, then you need to find a new provider. So today we're going to talk a little bit more about what we assess in our practice as far as the foot goes and how it affects literally everything that you're doing and how it can contribute to your hip, your low back pain, and your pelvic floor dysfunction, and the shoes that we recommend. So here we go. When I am looking at somebody from an evaluation standpoint, I'm looking at them from head to toe. But when I get them in standing, there's some really important components that we look at. Number one, we look at your toe splay. So what is that? That is whenever you put weight on the ground and your toes spread out to the side. So we want to see your toes splay wide.
I don't know if I can see it from right here. Hold on, not too close. Splay. Not splayed.
Sorry, I can go down.
Not splayed. Most people are wearing tight shoes, and when they take them off, their feet still look like this. We want spreading.
The other thing we're looking at is the arch of your foot. So when you stand up, what does your arch do when you weight bear? So when you don't weight bear versus weight bearing, does your arch fall? If your arch falls, face the camera. If your arch falls in more, it will actually affect everything up the chain.
Show from the back, because this is where we usually see it really well, this angle. And we're all midline versus here and active feet.
Do it again. Go in. And out. Do it again. Keep going. In. Okay.
And this affects all the way up to what the hips are doing. So that's what we're assessing. And usually the common thing that we're finding is the footwear that our clients are in are immobilizing their feet, and it's causing more stress at the ankle, knee, hip, low back. And they don't realize it until we put them barefoot to do the same movements, and then we get a lot more range of motion out of their feet. Or we see restriction in a certain movement pattern. So we're working on the full range of motion, then we can build strength in those movement patterns. But the key is getting them to understand that what they're in all day long, footwear wise, is making their issues that we're treating, which we can treat and make the pain go away temporarily, but it's not going to fix it from coming back if we don't fix where it's starting, which is usually at the feet.
So, we always recommend shoes, and we're going to go through a few different things that we are looking at with your shoe whenever you're coming in the door. But there are some very general things that we kind of keep in mind when we're recommending shoes, and then we'll give you our favorite brands at the very end.
Right. And I think these are also patient specific because the shoe choice needs to be based on your activity. So if you're a runner or if you're doing weight training or if you're just looking for something that you can wear every day, those situations matter as far as shoe recommendations. And so sometimes those get a little bit more patient specific. Maybe somebody does want an everyday shoe and then they want an activity shoe also. And so we have to know kind of what activities they're going to be doing. And we want to make sure that they're starting out with the appropriate footwear. And then we start looking at all the movement, stretching, and recommendations that we have to maintain all those activities. I would say first by understanding when you go in to buy a shoe, there's shoe descriptions. You've probably seen it. Your Hokas have a lot of cushion. Your Ultras, the shoes that I wear, they all have a description on the cushion, which is called the stack height. So that is considering how high the shoe platform is stacked with the cushion. Then you have a heel to toe drop. That's the shoes that you see have a high heel cushion, and then they're shorter on this side. That's the heel to toe drop. Then you have the overall shoe shape. I don't know if you can see it better against the wall. These have a toe shape. Your traditional shoes, which we don't have an example of, they usually are like this, and your big toe is pushed inward. We're wanting the toe to have some room to the outside. The other thing we look at is flexibility of your shoe. If your shoe is locked and rigid and you can't bend it, your foot's not going to do the same thing in your gait sequence when you're standing or you're being active. So that right there is already an external mobilizing shoe that we don't want. That means our feet cannot move. So we want flexibility, we want toe shape, we want minimal stack height. And so we can give specifics in the shoe wear that we provide. And then we want as minimal of a heel drop as possible. So I like zero drop, but even under a 5 millimeter heel to toe drop is okay. But it's also very patient specific. Those are just some ideas of when you are shoe shopping and we get in that discussion with you. I want you to be aware of how the shoe is described. So not every shoe is recommended for you. For just a walking shoe, you don't need a marathon running shoe that has a ton of cushion, puts you in a position where you're on your toes because the heel cushion is so high. So those are things we need to understand when we're buying footwear. What is that going to do to our feet and our gait cycle when we're wearing them?
If your foot is up like this, then it goes up the chain to where it shortens your
Posterior.
gastroc and it shortens your hamstring, which will actually tilt the pelvis and actually literally cause your low back pain. So, getting the zero to drop, if you do nothing else, that will actually save you a lot of low back pain. I want to dive into on the next video the exercises that we typically would recommend, but again, it's super general. If you don't have a toe splay, if your ankle falls in a lot, if your arch drops a lot, and if your ankles are really weak or unstable, you've had injuries in the past. So, right now, we're going to go over the main recommendations of our shoe wear that we do, and then we will use the next video to talk about exercises. The first one that we recommend is limbs.
This beautiful specimen right here.
Limbs are probably our number one that we recommend. They have the zero heel to toe drop. They're very flexible. The toe is very mobile. I would say the second one that we recommend is the Ultra. The Ultra is a little bit stiffer, has a little bit more cushion, and so if you've never done any sort of barefoot like shoe, then that's a good transition down to this. And it also depends on what you're doing for work. So I have these. I also have some limbs. And then the third one that I've been recommending a little bit is the Flex. Flex has a little bit more cushion, kind of like this. I recommend going half the size up, and it's more like a sock shoe. So you definitely need to have some really good ankle stability in order to be able to use the Flex shoe, period, especially if you weight it. So if you're a CrossFitter and you're using these barefoot shoes, you're going to actually have detrimental issues if you don't strengthen and stabilize all of your other joints and then you automatically weight it. So again, we're going to go over strength and exercises on another video, but for now, this is the video that we talk about for the requirements that we do for shoes and the highest recommendation shoes that we provide.
Right. We just want to provide you an education on what impact your shoe has on your activities. And then even some of these shoes, they have different models that we would still recommend. So these are just the brands, not the exact shoe. Based on the patient and their necessities, we would recommend a specific shoe that maybe has a little bit more flexibility, a little less cushion depending on the activity, or just everyday use. So those are just big topics that we like to get into more on a personal level. But if you can understand the impact and what the shoe design does to you, whether it's positive or negative, we just want you to be educated and make a powerful decision that you're wanting to make for overall health.